Hello everyone, and welcome to our virtual educational program. In this module, we will be discussing aphasia. According to the American Speech Language and Hearing Association, aphasia is a language disorder that affects how one communicates. It is caused by damage to the language centers of the brain, usually in the left side of the brain, which control understanding, speaking, and even using sign languages. Aphasia does not make one less smart or cause problems with the way one thinks. However, it may affect your ability to communicate your thoughts easily. Aphasia can lead to trouble communicating, understanding language, and reading and writing. In terms of communication, people with aphasia may have trouble thinking of the words they want to say, or finding the words that are on the tip of your tongue. They may also switch sounds and words, such as saying wish dasher instead of dishwasher. Additionally, they may say the wrong word. For example, they may say something related in meaning, like fish instead of chicken, or in sound, like art instead of arm. It is not uncommon for someone with aphasia to also make new words that do not have meaning to other people, to repeat the same word or phrase, or to have a hard time saying longer sentences. As for understanding spoken or sign language, someone with aphasia may have difficulty with the following: recognizing objects by their name, following direction, understanding what others are communicating, especially if they are speaking fast or if they are speaking of an unfamiliar topic, understanding when multiple people are talking at once, or when there are a lot of auditory or visual distractions in the environment. And lastly, understanding language that is not direct or straightforward. Examples include jokes, puns, sarcasms, and phrases like better late than never. Lastly, in terms of reading and writing, people with aphasia may have difficulty reading signs, forms, books, and computer screens. They may also have trouble spelling and putting words together to form sentences, and using numbers or doing math. For example, it may be challenging to tell time or count money. So, what causes aphasia? Aphasia is most often caused by a stroke. However, any change to the brain, including a traumatic brain injury or a brain tumor, can cause aphasia. Depending on the area of the brain that has been affected, there are 6 subcategories of aphasia. First, global aphasia is the most severe form of aphasia, as individuals with this type may have difficulty both speaking and comprehending speech. It can be seen mostly immediately after the individual has suffered a stroke or injury, and it may rapidly improve if the damage is not too extensive. Second, Broca's aphasia happens when there is damage to the front portion of the left side of the brain. This type of aphasia is characterized by non-fluent speech. Individuals with Broca's aphasia have halted speech patterns and have difficulty making sentences. However, speech perception is not affected, and language comprehension is normal. Third, mixed non-fluent aphasia. This term applies to patients who have a sparse and effortful speech, resembling severe Broca's aphasia. However, unlike individuals with Broca's, they remain limited in their comprehension of speech. Fourth is Wernicke's aphasia, which happens when there is damage to the posterior portion of the left side of the brain. This type of aphasia is characterized by deficits in comprehension of language. Individuals with Wernicke's aphasia may have fluent speech, but the content may not make sense to listeners, as the individuals themselves cannot understand what they are saying. This type of speech is often described as jargon aphasia. Fifth, anomic aphasia. This term is applied to individuals who are left with a persistent inability to supply the words for the very things they want to talk about. They understand speech well, and in most cases can read adequately. However, they may experience difficulty in finding words, both in speaking and in writing. As such, individuals with this type of aphasia often cannot name objects, but at times they offer substitutes, and they usually can demonstrate the function of the object they are referring to. Last is primary progressive aphasia, PPAA, which is a neurological syndrome in which language capabilities become slowly and progressively impaired. PPA is caused by neurodegenerative diseases, such as Alzheimer's disease. How is aphasia treated? The goal of treatment for aphasia is to improve the individual's ability to communicate through methods that may include speech-language therapy, occupational therapy, nonverbal communication, therapies, and group therapy for patients and families. Living with aphasia. Some people with aphasia recover completely without treatment, but for most people, some amount of aphasia remains. As such, it is imperative for caregivers and family members to learn the best ways to communicate with their loved one. And lastly, here are some tips that may make it easier to communicate with a person who has aphasia. Using simple language and short sentences. Get their attention before beginning to talk. This can help them focus and avoid external distractions. Repeating keywords or writing them down to clarify meaning as needed, and slowing down speech. Using natural conversational manner at an adult level, and keeping your voice at a normal level. Encouraging all types of communication, including verbal, gestures, pointing, writing, or drawing. Refraining from correcting the individual's speech to sustain confidence. Giving the individual plenty of time to express themselves. Using yes and no questions to offer simple options if needed. Giving them choices instead of making open-ended questions. For example, do you want to watch TV or go to the movies? Instead of what should we do this afternoon? Helping the person become more involved outside of the home too, such as through support groups. The National Aphasia Association provides a free, downloadable book for caregivers of individuals with aphasia. You may find a PDF copy of this book on our website, or you can scan the QR code with your phone on this page to visit the National Aphasia Association website. Thank you for your attention during this presentation. We hope the information in this video was helpful to you.